Hi, good morning, everyone. My name is Bridget Skelton, and I'm a registered nurse with Caravita Home Care. Today, I wanted to come to you with this video to show you a little bit about our Caravita resources and who we are as a company. Um, I'm a registered nurse, and I have been a nurse since 2004, and I function in the role of Vice President of Business Development for Caravita. Caravita is a home care company. We actually are Caravita Senior Care Management and Caravita Home Care. So what that means is that we have both assisted livings that we manage, and one is a nonprofit, Woodland Ridge, which is on the campus of the Ridgeview Institute, and the other community is the Springs, which is located in South Carolina. The home care side of our business, which is what we're going to focus on today, has been in business since 1998. I have shared with you here our website. So our family, our Caravita family, has been caring for seniors in our community since 1998. We are a home care company that specializes in non-skilled certified nursing assistants coming to your home to help your loved one wherever home may be in assisted living, memory care, independent living, or private home to help your loved one with activities of daily living. And so that is what we're going to talk a little bit about today and what that means. And we also have a skilled nursing license, which also provides a higher level of care. And we provide also proxy care, which is kind of in the middle, where you can have a nurse that oversees the care, but a certified nursing assistant that actually provides the care. So welcome to our website. As I mentioned, this is who we are. We can always set up a free evaluation into your home. So as you scroll down our website at caravita.com, you can request a free evaluation, and it'll take you to the link on our website to fill that out. And a nurse will come out to your home, and we can evaluate some care options with you and your family. We also have personalized services to meet your needs. So again, like I talked about, we are located in Roswell, but we service the greater Atlanta metro area. And actually, we are licensed in most counties in Georgia. So give us a call just because you or your loved one may live in one county and your loved one may live in another. We may be able to service that area. So we have right here on our website the ability to explore care options. And I think that's really important because many times there is a misunderstanding of what the care options are for families. We tend to kind of group things in buckets and, okay, you get this type of care just because, or you're going to this level of care from hospital discharge just because. And not to bring up the elephant in the room, so to speak, but with COVID-19, we're really trying to avoid anyone in that high-risk population over age 60 with comorbidities, and most definitely over the age of 80 with comorbidities, from going to the hospital unnecessarily. So many of the things that I'm going to share with you are things that we can put in place to help your loved one reduce the risk of having to go to the hospital, whether it be by having a caregiver in place when they're at home at night alone to reduce the risk of falling when getting up in the middle of the night to go to the bathroom, or do they need a little bit of extra care during the day to remind them to take their medications so that their blood pressure doesn't drop, or that they don't forget their insulin or other essential medications, which could lead them to having to go into the hospital. So we have this level of care that is called companion care. And the companion care is what people a lot of times think home care is all about. And it is one of the areas that we love to showcase and shine the most, because companionship is a big part of what we do when we age, right? So we need some companionship, isolation, loneliness, especially now with social distancing. Having a one-on-one dedicated caregiver can reduce your risk of exposure, but also decrease the likelihood, because you're with that one person, and decrease the likelihood of being exposed to other people that may have contracted the COVID virus and maybe spreading it asymptomatically, but also reducing the risks that are associated with social isolation. So the companion care comes with meaningful engagement. The caregiver will come out to the home and socialize with your loved one, engage with them, do activities that are purposeful to them, that make them feel like they're leading a purposeful life. And that is so important right now. They will also do the shopping and the errands. So if your loved one is high risk and they are unable to get out to the grocery store, or they don't want to go to the grocery store because of obvious reasons with the risk of transmission and the crowds and the chaos out there, we will do that grocery shopping and errands for your loved one. Transportation to and from appointments. And wanted to go back to that with the shopping and errands. Right now, it has become increasingly difficult to get the Instacart options or some of the other home delivery grocery options because everybody is using them. So we have had this service in place for 20 years. So it's, the caregiver would get the list of things that your loved one needs and wants and goes to the store themselves and purchases them for your loved one. We do the meal planning and preparation as well as light housekeeping. So that all falls under our companion care. Our personal care that I want to highlight here on our website is our in-home care for people that need assistance with activities of daily living. So a lot of times you may hear the abbreviation ADL assistance. Well, what does that mean? Because that's not in our everyday language. I even being a nurse for years, I never heard people use the word ADLs. And so I think sometimes we take that for granted in our industry because we use that language so much. But what does that really mean? Well, when you think about the activities of daily living, think about the daily tasks that you do every single day when you get up in the morning or before you go to bed, or throughout the day that help maintain your health and wellness and overall well-being. So in addition to the social engagement, which we all need in order to thrive and feel healthy mentally, which is very, very important, and the shopping and transportation, we also do the assistance with the bathing, dressing, grooming, and sometimes it's just having someone there that can be on standby assistance when getting in and out of the shower, right? You don't want to fall when you're getting in and out of the shower, or someone to help you just to reduce that risk of the fall. Mobility assistance and ambulation. So walking is so important in maintaining the ability to walk. So oftentimes people will become wheelchair bound out of fear of falling. And while I think that that's not necessarily unreasonable, it is not always the best option right away, because with therapy and with someone helping you get up and about, you maintain that muscle tone and that ability to stay ambulatory for as long as possible. And staying ambulatory, which means walking, that's that ambulation word that you'll see here, ambulation or up and about and movement. It reduces the risk of skin breakdown. It reduces the risks of, other types of infections that come from being sedentary, right? If you're incontinent and you're sitting all the time, it does increase the risk of urinary tract infections. There are a lot of other risks that are associated with losing your mobility. So we want to try to preserve that as long as possible. And of course, we'll do the meal preparation and feeding if needed, and restorative exercises. So we have a phenomenal restorative program that we work together to form an exercise program for you and your loved one, and carry out the home exercise program that may have been assigned by the physical therapist prior to ending home health services. Also, we have our Alzheimer's and dementia care, which is our Dementia Life program. And it uses dementia-trained caregivers to provide care that's customized and specialized for your loved one. So let's talk a little bit about what that means. So we, in addition to, we talked about the companionship and we talked about the personal care, but the Alzheimer's and dementia care is a multifaceted program that brings in all of that information, but also now with a cognitive and a behavior approach. So we do a functional 24-hour schedule. So if we are in the home, a lot of times people don't know we offer a live-in service. So where it's one caregiver that stays 24/7, they sleep there in the home and they're there 24/7. But we can also do this even on our shorter schedule clients. So it doesn't have to be our live-in or 24/7. But we do the behavior monitoring. is there a certain activity that is creating anxiety for your loved one, that is causing some behavior expressions? We do this in order to minimize the behavior outburst. We also do a detailed life story. So we take a look at who was your mom, who was your dad when they were growing up, meaning what did they like to do? What type of person were they? Were they extroverted? Were they introverted? Did they have certain things that they've never liked to do? And so getting them to do them now is not going to be a way to reduce those behavior expressions. And so we really try to follow their life story. What was their occupation? What were their passions? What were their hobbies? Where did they grow up? What type of environment did they enjoy being in? Did they grow up on a farm, or did they grow up in a metropolitan area where there were a lot of people and busy and hustle and bustle? So that life story is very important in understanding how someone may be trying to communicate with you once they've lost their ability to be expressive. We also rely heavily on the reliable daily rhythm. If you see here, that daily rhythm is very important. So someone that does not have a dementia diagnosis and in an assisted living may have a little bit more leeway and flexibility. Maybe they want to sleep in a little bit and not attend breakfast, or not have breakfast and have brunch instead, and then get to bed a little bit later. And that is all fine. But when someone has dementia, it is very important for them to have a rhythm of their day. That sleep-wake cycle is very important at reducing behavior expressions and sundowning as well. You probably have heard that term before, but that's where you really kind of, in those the bewitching hours, so to speak, the between 3 to 7 p.m. that you start to see a lot of restlessness and unsettledness, and that has to do with the sleep-wake cycle and the way that your body responds to that circadian rhythm. So behavioral support. If we have tried everything and there is still additional behavior expressions, maybe aggressive behaviors for certain types of dementia, so not necessarily just Alzheimer's, that typically you don't see that in Alzheimer's, but in Lewy bodies and other types of dementias, you may start seeing some visual hallucinations and some aggressive type behaviors or tendencies. We also recommend the support of geri psych physicians if needed, other types of services that may be needed. So we're there to help reduce that and reduce the over and unnecessary use of psychotropic medication. So we work with you and your loved one in reducing the overuse of that in order to manage behavior. So we try to understand what your loved one is trying to tell us through that behavior expression. And then, of course, we've got all of the creating moments of joy throughout the day, cognitive stimulation, what gets them engaged, what activity do they like to do that actually engages them, food preparation, outdoor activities, family time, all of those things are so very important. And so that is our Alzheimer's and Dementia Care Program. And I'm just going to scroll on down here to talk a little bit more about our medical side and complexity on the medical side of our business. So one of the things that we also do, because your loved one may have different layers to their care needs, right? So they may have traditional companionship needs, maybe need a little bit of ADL assistance, but as they progress along and they have dementia, they also need a little bit of this behavior support. And then now, because of the way that certain diseases and diagnoses continue to be progressive, they now have a need for a proxy caregiver. And let's talk a little bit about what that means. A proxy trained caregiver is a caregiver specifically designed to help people living with disabilities to maintain their independence. So everything we do at Caravita is to help your loved one reach their highest level of independence as possible. So sometimes families make a hard and challenging decision. Do they want their loved one to have a feeding tube? Or now they are in need of a Foley catheter for whatever reason, whether it be they've got retention in their bladder, they're not able to empty their bladder, they need a Foley catheter, or they've had a bowel obstruction where they need an ostomy, or they've had that all along, right, for years because of Crohn's disease or other medical necessity. And they need medication administration. So I'm not talking about assistance and med reminders or assistance with self-administration. I'm talking about true med administration where we're going to be giving, helping to give a an insulin injection for diabetes, or some other type of vitamin B12, some other type of administration where it's true that they truly administering the medication, not assistance with medication administration. And so that is our proxy care program. And what we do is we send in a caregiver that is trained by the registered nurse on those specific tasks for your loved one. And the physician has to actually sign an order, and the family can sign a consent. So we can do those G-tube feedings, and we can do that higher level of care. And that helps keep your family member from having to go into a skilled nursing facility or a nursing home unnecessarily. And many times the assisted livings are not able to do sometimes in that level of care. Sometimes they are, and they just need a little bit of support from us. So it just depends on what type of community, depending on what they will accept. So we like to be an additional resource in the event you're not able to find someone to do that level of care. We also have done a lot of proxy care for really special medical need clients, like the ALS Society. We partner with the ALS Society, muscular dystrophy, multiple sclerosis, other neurological diseases that may impact continence, needing a bowel program, feedings, things like that, and mobility. Transitional care. This is formally called, or previously called, our hospital to home program. So our transitional care program consists of us helping your loved one transition from the hospital or rehab or SNF setting to home, because many times their length of stay in those facilities have become less and less due to Medicare guidelines, and Medicare regulations have changed recently. And so they are coming out of those settings still needing a little bit of care. So we have our transitional care program that brings in medication review and oversight by a registered nurse, vital signs health monitoring. We do the restorative exercise program that I mentioned previously, where we follow the exercise program outlined by the physical therapist. So they guide the exercises and we conduct them. We also do activities that increase their mobility, nutrition oversight, the use of adaptive devices and adaptive equipment, so we can help with, it's a Hoyer lift or a special hospital bed or any type of durable medical equipment. We can come in there and help get that set up and make sure that things are set up appropriately. Any education that needs to be done with another family member, let's say it's a care partner that lives with the client or lives with your loved one, and you just need a little bit of help to kind of get over the hump. Now they've been in the hospital, this is their new norm, what do we do now? Transportation to medical appointments and proxy care if needed. And last but not least, we provide skilled care. So we have a skilled nursing license, and so we are not trying to take the place of a Medicare home health company, because we are not a Medicare, we do not bill traditional Medicare for the services that we provide. The services that we provide are either paid by long-term care insurance, VA aid and attendance, their own private pay, retirement benefit, things like that. And so with the skilled care benefit, or a skilled care service, mind you, we partner with home health because with their cutbacks too and Medicare changes, they are not able to do a high frequency of visits many times. So we partner with them. We can help subsidize different visits that they may need to be done. So for instance, if a dermatologist conducts a procedure and they need a daily wound care done for that or dressing change, then we will, if home health can go in 3 or 4 days a week, then we can go in for the dressing change for those other 2 or 3 days, or just whatever it might be. So we try to help partner with home health agencies on this. We also we have a geriatric care manager, licensed medical social worker, and we work with our registered nurses. They're called clinical liaisons. We have a phenomenal team that can go out and do these assessments and care coordination, post-surgical care, all of those things, and get your loved one back up on their feet. And then last but not least, we partner for respite care. We actually are a provider of the LMK Foundation. So that grant that allows for people to receive the voucher for respite care, they typically will call us and we are a provider for that. So we, in addition to doing that for the LMK Foundation, we can do that for the general public. If you're going on vacation or you're going on a trip, or right now just with the crisis going on, needing a little bit of help and reprieve. Maybe you've got to work from home, or you've got to work helping a loved one, and you need a little bit of assistance for your aging parent or anyone else. So we do all of this. That's what that means, is that we can handle all these measures and let you handle your business and come in as a respite relief. Okay. So that is kind of who we are and the services we offer. And now I want to take you to our resource page on our website. These resources are amazing. Most are free to you, and you can download these resources. So we help you take different assessments, like a home safety assessment, the nutrition piece, self-care. It walks you through answering those questions. Our virtual dementia tour is something that we really want to highlight. We are partners with the Second Wind Dreams. We actually, I am a trained facilitator, and then we also have certified trainers also for the virtual dementia tour. And we conduct this in our office in normal settings when we're able to have groups come in, and they take the experience. They go through the virtual dementia tour, and they are able to experience what someone may feel and experience if they have dementia. And so it's a simulation. It's very eye-opening, and it's truly giving you a sense of what it must be like to walk in the shoes of someone who has dementia. The home safety assessment, this is a great tool and resource for you to have and download, because it helps you understand things that may be a fall hazard or a trip hazard, or what may or may not be safe in your home. And then we've got tips for talking to your parents, suggested resources. I love our suggested resource page. This is one of my most favorite pieces that we have, because we've got ways of end-of-life planning, and it will take you to just what you need to do for that, facing other illnesses, Parkinson's resources, caregiving journeys, all types of resources. So feel free to take a look at all the resources on our page. And as always, this is our number. So you can call us anytime, and we do have a 24/7 response line. We have case managers available even on weekends. We do a manager on duty rotation, and we are always here to help you. So I hope I helped you better understand who we are at Caravita Home Care and our caregiving journey, and why it's so important to us to help you in your journey. And we look forward to working with you. Thanks so much, and have a blessed day.